KLFY News 10 online. Go to our website at klfy.com. And now, Meet Your Neighbor is on location.
Cardiovascular Institute of the South is one of the first to offer patients who have AFib but are blood thinner dependent another option. Dr. Salvaggio and his colleague, Dr. Saad, were the first on July the 17th to use a device called the Watchman. Now, this is a pretty intriguing device and a great option, and Dr. Salvaggio is going to tell us all about it today. Now, first of all, Dr. Salvaggio, what is AFib?
Well, AFib is an abnormal heart rhythm that affects millions of people in the United States. And actually what it does is it causes the heart to beat irregularly and causes the blood to flow abnormally in the heart and can predispose you to a blood clot, which can essentially lead to a stroke.
Now, what is the Watchman?
So the Watchman is a one-time permanent implant that is placed into the heart in a certain area of the heart where it's felt that over 90% of the blood clot causing the stroke forms. And it goes into that little spot in the heart and prevents the stroke from occurring.
Oh, that's good. Now, tell us how the procedure works.
It's actually a one-day procedure. Patients come in. The procedure gets done, takes about an hour. We access a small vein in the leg, carry a tube up to the heart. We cross one area of the heart to another and take this implant device and put it into the area of the heart that can form the blood clot. We take the equipment out. At the end of the procedure, the patient's monitored overnight and usually goes home the next day.
Not bad. Now, who is a good candidate for the Watchman?
It's a good question. Most patients with atrial fibrillation who can tolerate a blood thinner are good candidates for this procedure. And in particular, patients who've had trouble with blood thinners in the past or are looking for an alternative to a blood thinner.
Now, what are the benefits to someone who has the Watchman?
Well, the big benefit is you no longer have to take oral anticoagulation for the rest of your life. So in particular, patients who could take the blood thinner but would periodically have bleeding disturbances will no longer have to deal with that.
Why did CIS decide to offer this option to patients?
Well, it's very important to us because we have a large structural heart program, and we already take part in replacing heart valves through small holes in arteries and veins in the groin and repairing valves, and this was the final part of our puzzle for our complete structural program. Not to mention it is a huge benefit for our patient population.
Now, for those patients who want to find out more about it, maybe want to do their research, is there someplace they can call, someplace they can get that information?
Absolutely. They can call our clinic anytime. The number should be on the bottom of the screen, or also visit our website at www.cardio.com.
All right, Dr. Salvaggio, obviously he knows a lot about the Watchman, and being that he was one of the first here in Lafayette, you can trust Cardiovascular Institute of the South, cardio.com, for more information.